Welcome to webinar series hosted by Happiest Health. Happiest Health is a global knowledge platform on health and wellness, and we bring to you a series of webinars on various health topics. I'm Revati, and I will be your host for this session on World Liver Day in association with Happy Zest. A liver disease is any condition which affects the normal functioning of the liver. The most common liver diseases are hepatitis A, B, C, liver cirrhosis, and non-alcoholic fatty liver disease. Left untreated, liver disease can lead to liver failure and liver cancer. In 2019, liver cirrhosis was associated with 2.4% of global deaths. But that is an extreme case that one can prevent with smaller steps and changes in our daily lifestyle. The topic for today's discussion is healthy lifestyle, key to staying away from a liver transplant. We have an panelists who are experts in this field joining us today. First up, we have Dr. KS Sekhar. He's a gastroenterologist and hepatologist at Apollo Hospitals, Hyderabad. He's a Medical Council of India certified gastroenterologist with a specialty in hepatitis, pancreatitis, biliary diseases, colon problems, and gastric problems. He's skilled in all endoscopic procedures, including ERCP, colonoscopy, and upper endoscopy, and performed over 14,000 procedures in the last 10 years. Welcome to the session, Dr. Sekhar.
Thank you.
Next up, we have Dr. Aditya V Naragund. He is the Director of Gastrosciences and Soft Tissue Robotic Surgeon at AASRA Hospitals in Bengaluru. He's the Director of Gastrosciences, HPB Surgery and Soft Tissue Robotic Surgery. He has over 14 years experience in the surgical field and 11 years in the field of surgical gastroenterology. His passion lies in the field of hepatopancreatobiliary surgery, and he's also trained in liver transplantation. He's trained and worked in minimally invasive surgeries and is also a certified robotic surgeon. Welcome to the panel, Dr. Aditya.
Thank you.
Next up, we have Dr. Prasanna Bhat KS. He's a hepatologist and liver transplant physician at Manipal Hospitals, Bengaluru. He's a specialist in liver and hepatobiliary surgery with experience of over 15 years. His expertise in treating gastroenterology disease, abdomen pain, and many more. He's performed over 5,000 upper and lower GI diagnostic endoscopies and has vast experience with emergency liver and GI cases. Welcome to the panel, Dr. Prasanna.
Thank you. Thank you.
Well, the idea is for our attendees to have a basic understanding of liver diseases and what leads to it. And most importantly, what are the steps that one can take to prevent it? And we're looking at simple steps in our day-to-day life, simple changes that we can make. So starting off with Dr. Sekhar, just want to understand, is there an increase in number of people who are requiring liver transplant in the recent years?
Definitely, I would say yes to that question, ma'am. We are seeing a lot of patients. It can be of different reasons. You can't just say that the liver diseases are increasing recently, but it is the awareness, the number of procedures to diagnose liver cirrhosis and early diagnosis. And all these things are definitely playing a role. And people who require liver transplantation are increasing in numbers, and number of liver transplantations are also increasing. So the success rates of liver transplantation at this point are very good in India. So that is one more reason why more and more liver transplantations are happening these days. Yeah, diseases of liver, they are definitely increasing. And nowadays, the most important thing, the biggest elephant in the room is the fatty liver, which every one of us, I mean, at least 40% to 50% urban population are having fatty liver, and this eventually progresses to cirrhosis. So this can be one of the reasons for increasing number of cases.
Okay, just quickly want to ask that, Dr. Sekhar, in your experience in this field, if you take the beginning of your career to now, if you're saying increase, what would that number look like?
Yeah, I would say at least 30% increase in number of transplantations.
Okay. Also, you pointed out that that necessarily does not mean bad news. It could also mean that increased awareness. That brings me to my next question. Dr. Aditya, what are the major urban lifestyle risk factors that pose a serious health threat to your liver?
See, what we are seeing with the population these days, especially with the IT sector booming, the general standards of living have increased. Especially in the urban sector, we see a lot of fast food chains, junk food. It's available rampantly. People don't cook food. They tend to order online. See, these are all small things, but what they add up to is a lot of calorie consumption, unnecessary calorie consumption, a lot of stress because of work, lack of exercise, and a lot of carbohydrates, fat intake. Everything has increased without a proportional increase in the activity. In fact, there is a drastic drop in the physical activity which people are having these days compared to what they eat. So this automatically translates to increased fatty liver, obesity, diabetes. So all this results in, again, liver problems. So I think the urbanization which we are seeing, it is definitely, it has caused a major problem to the liver per se.
Right. So there is the convenience factor, but that convenience is leading to a lot of complications.
A lot of issues.
What you're
Yes,
pointing
yes.
out. Dr. Prasanna,
Yes.
what is the most prevalent form of liver complication among the young and middle-aged population?
Okay, I wouldn't say complication, but then if you ask the common liver problem that this middle age and younger generation also for that matter have is fatty liver. I think that everybody is kind of able to see a jump in number of fatty liver that's being kind of identified. Say, just for example, when I was doing my MD thesis, it was my thesis topic, like fatty liver in, say, general population. It was somewhere around 18-20% at that point. In fact, it was somewhere in 2000s. So now if you see, the same thing has increased to somewhere around 40 and maybe upwards of 40% if you choose a set of patients like in urban middle age, say from 25 to 45 or something like that. And more so if there are, say, diabetics, because India is the world capital for diabetes now. And the diabetes is starting at a much younger age, say somewhere around 40s, maybe late 30s and 40s is when most of them get diagnosed with diabetes. And sorry to say or to identify, but then around 85% of patients with diabetes invariably will have fatty liver, maybe at times 100% before they get diagnosed. So these are the ones, if not taken care, because say 35-40 is the age when they don't really understand the seriousness of these conditions. They think they can manage because their parents were able to manage it when they got it around 50. But if they get it around 35, those 15 years are very important. If they don't take care of themselves properly, by the time they understand that they are landing up in serious troubles, usually they would have serious troubles already, which will be difficult to manage. I think diabetes, fatty liver, the lifestyles which Dr. Aditya explained, all these things are bigger things which people don't understand as an individual. But when we see from the other side, these are all very big things which are difficult for us to make them understand. I think it requires a lot of awareness. Something like this can maybe help in creating those.
Dr. Prasanna, since you mentioned fatty liver, that is the most commonly seen problem among the population. In a layman term, could you just simply fatty liver disease is for common
liver diseases? So what you're asking is what fatty liver is, right?
Correct. In a very layman term.
Yeah, in a very layman term. See, people, I mean, for everybody to understand, whatever the extra calories you consume, by the end of the day, the body makes a profit loss statement. If you say consume 100 kilo, 200, 500 kilos extra, that will all, whatever may be the form, carbohydrate, protein or fat, it will all get converted into fat and it's stored. The only way body knows to store extra calories is fat. So everything gets stored as fat. So this fat, when it gets stored for a period of time in multiple parts of the body, it will get stored. Usually like adipose tissue is where it is supposed to be. But when the storage increases goes beyond certain limits, then it starts get accumulating in the liver itself, because that's where it all gets happened, the conversion of everything into fat. So that gets accumulated in the liver, and fat is basically say a small balloon kind of a thing you can do for simple understanding. So when it starts getting accumulated, those smaller balloons start say compressing on the liver cells, normal liver cells, and ultimately the liver cell starts dying. And liver cell death is basically injury to the liver, and injury is always kind of is reacted in a way it forms a scar. So when the scarring happens repeatedly over a period of time, say 10, 15 years, or 5, 10 years, 20 years, then usually those scars cannot be replaced. So those scars take over the normal cells, and that's where the liver cells get damaged, and then you end up in serious complications.
Right.
So the basic point is extra calorie, whatever you consume. You don't really think and eat, you just keep eating whatever that comes. Affluence has come with these things, and that actually causes this problem. So eating consciously is what would lead to a significant change at the end of the day.
Right. Right, Dr. Prasanna. Dr. Somashekar, coming back to you, when you talk about liver disease, it's often associated with alcohol consumption. But I'd like to ask you, what is more dangerous for liver, alcohol or excess consumption of junk food and refined carbs?
Definitely, at this point of time when we are talking, alcohol is the most common cause for liver disease and even liver transplantation in India and worldwide. But when we are comparing these two, alcohol, the number of cases of alcoholic liver disease are coming down, and the number of cases with fatty liver disease, non-alcoholic fatty liver disease, are going up. And in next 10 years, definitely the most common cause for liver transplantation would be non-alcoholic fatty liver disease than alcoholic fatty liver disease. Problem here is everybody of us, I mean, anybody, it need not be a medical professional. Everybody knows that alcohol damages liver, and alcohol causes liver diseases. But people are unaware that fatty liver is problematic, and this can also cause cirrhosis. This people are unaware, and there is a lack of awareness about this fatty liver. And people don't know the seriousness of fatty liver here. So when you ask to compare these two, I would say fatty liver is more dangerous because people are not aware of it, and they present to us only after the liver goes into cirrhosis most of the time.
Right. Right, Dr. Somashekar. I'll lead that question to Dr. Aditya. How prevalent is non-alcoholic fatty liver disease? Now, Dr. Somashekar pointed out that alcoholic liver disease is coming down and non-alcoholic fatty liver disease cases are going up. If we have to put that figure out to our audience, then how prevalent is it?
Yeah, so what I was saying is, though American Association says it's 25%, India being the diabetes capital, the estimate here is around 33 to 35%, if I'm not wrong.
Of the total liver conditions?
Yes. Non-alcoholic fatty liver disease, or when it turns into what we say NASH and cirrhosis, the incidence of patients who present with cirrhosis, 33% do not have any alcohol consumption.
Okay.
So it's always attributed to non-alcoholic fatty liver disease or NASH, diabetes, these things leading to cirrhosis. In fact, a lot of my patients, they come and say, like Dr. Somashekar was saying, they come with cirrhosis and they cannot believe that they have cirrhosis, because they are teetotalers. They have not had any non-veg food. They come and say, I don't eat non-veg, I don't drink alcohol, I don't smoke, I have no bad habits, but I am suffering from liver cirrhosis. This is because they don't know that they have diabetes for the last 20 years, and they think it is under check, but unfortunately, many a times, the diabetes is not controlled well. So what happens is the liver keeps getting damaged without their knowledge. So that is why it becomes more worrying, because patients are not aware that they are suffering from this problem.
Okay.
Right?
Yeah, Dr. Prasanna, you had briefly mentioned about diabetes, and now Dr. Aditya has also mentioned it. I want to understand type 2 diabetes and obesity, the increase in these cases. Has it led to a proportionate increase in liver diseases as well, a direct relation? And what is really the link between type 2 diabetes and non-alcoholic fatty liver disease?
Okay, I think the correlation is very direct, because the underlying reason for diabetes and fatty liver, that is insulin resistance, we say. The people are producing more and more insulin, but then kind of it's not enough. The sensitivity has gone down. So the insulin resistance is the reason for development of diabetes and also the fatty liver. The interesting part is, say the development of diabetes is the last stage of that insulin resistance, and the development of fatty liver is somewhere in the initial period of insulin resistance. So if somebody has, say, family history of diabetes and they have fatty liver but not diabetes, the likelihood of them developing diabetes in the near future is quite high. So there is proportionate increase in number of fatty livers, though actually the number of fatty livers will be more than even the diabetes because it precedes the onset of diabetes. So if you develop fatty liver, if you have family history of diabetes, you must be really worried about developing diabetes in the future. Even if you don't have family history of diabetes, even then you're at risk once you have fatty liver because the underlying reason, that is the insulin resistance, already you have developed. So I think it's the most important point that the general public needs to know, which people are not aware of. And the most important reason for development of diabetes is the lifestyle. Lifestyle means the physical inactivity, the food habits, and then the stress levels. Everything put together causes this insulin resistance. If not taken care of, invariably most of them would develop diabetes, and subsequently the complications of those.
Right. While we always say that, a person with diabetes is at risk for various other health complications, much more than somebody without diabetes. In this case, like you mentioned, if there is a non-alcoholic fatty liver disease, a condition that's there, they should also look out for diabetes. I believe that's what you were trying to make a point. All right. So you, all of the panelists so far have also mentioned about the food intake very importantly. Dr. Somsekhar, I'll come to you with that question. What is a liver-friendly diet? And can NAFLD be reversed through diet and lifestyle alone?
Yeah. So first and foremost thing, the questions are two, but the answer would be the same thing. Liver-friendly diet is the one which reverses non-alcoholic fatty liver disease. To keep it in simple terms,
to be a little more clear, can it be reversed at all just by diet and lifestyle and no other intervention?
It can be reversed till some stage. At one stage, so beyond that stage, it may not be reversible. So even in non-alcoholic fatty liver disease, most of the time, if we can identify this patient at a stage where it is reversible till it goes into cirrhosis or F4 fibrosis. So before that, if we can identify, it is still reversible non-alcoholic fatty liver disease. And the diet, I would like to keep it very simple for everybody's understanding. Cut down on any fatty foods and oily foods, deep fried foods, eating outside. These are the most important things where we have bad oil usage, something which is fried in oil, all those things, and all these westernized foods with cheese and all those things. Avoid those. Increase the quantity of fresh fruits and vegetables in your diet, which is not seen these days. Most of the time, people are ordering food from outside. The fresh fruits and vegetables are very less used. Increase the quantity of fruits, vegetables in your diet. There should be a balanced protein intake, definitely. Protein intake, best protein would be egg, which has 100% bioavailability. And any protein, non-vegetarians can have chicken and fish, and vegetarians can have something like paneer or soya bean. This is good protein. It should be there in your diet. But the quantity of fruits and vegetables should be more fiber, fresh fiber. And it has antioxidants, which is good for your liver. So not just for your liver, it's good for your general health also. So these are simple things which needs to be modified and adhere to. And most important thing would be physical activity, which people are not doing. With dietary modification and physical activity without any medications, non-alcoholic fatty liver disease is always reversible.
Right, Dr. Somsekhar. Dr. Aditya, my next question is to you. There is a common perception that men are more likely to die of liver cirrhosis and complications. And this is based on an old school notion that men consume more alcohol. Is this true, or has there been a shift in this gender equation due to change in lifestyles?
No, actually, yeah, earlier, as you said, we used to see that men are more suffering more often from liver cirrhosis. But nowadays, we see a lot of women. One, diabetes doesn't look at the gender. It can affect anybody. Lifestyle is, again, it doesn't look at the gender. It depends on how you maintain your lifestyle. So it can be a male or a female. both are at equal risks. In fact, with urbanization and with a lot of females consuming alcohol as well, it is interesting to know that females are more prone to cirrhosis or liver problems with lesser consumption of alcohol. Men can consume a little more alcohol than females, in terms that the effect on the liver for women is faster with lesser alcohol consumption compared to men. So with urbanization, with the lifestyle, and with the added lack of exercise, unhealthy diet, add to that the stress of working, irregular habits, binge eating. When we look at all these, women have definitely, some things are more common in men, but women are equally, if not more, likely to develop cirrhosis in the current scenario that we are looking at. Yeah, earlier alcohol was not very common among women. In our country, we are talking about our country, so it was like a taboo for women. But nowadays it is not so. There is equality everywhere, so the equality translates to the disease as well.
All right. While what you said might seem like good news for men, let us say this is no endorsement.
No, it's not. It's not good.
Consumption.
I'm just telling about the quantity of alcohol which
Absolutely.
can cause liver problems.
Right.
That's all I'm talking about. There's no good news for men here.
Absolutely.
Yeah.
Dr. Prasanna, do you think there is enough awareness among the public about liver donation? And what are the main hurdles if someone is in need of a liver transplant and if somebody wants to donate it?
Okay, I mean, if you're asking about a live donor or a deceased donor, I think it makes a lot of difference.
Okay, no, because recently a 17-year-old girl approached the Kerala High Court and became a living organ donor, giving a part of her liver to her father.
Yes.
She had to do that because she couldn't get a live donor for her father.
Yeah, I think the awareness about both living donor and deceased donor are quite less in India. That's why we see so less deceased donor organ donation for that matter. Except I think cornea, the eye donation is much more kind of is common. Other organ donation is very, very less compared to say Western counterparts. We don't really see much of organ donation happening in India, though it is improving. Say year on year, slowly it is improving. And that's where, because of lesser donations, deceased donor donations, we are doing more and more living donor liver transplants, which again is difficult in most of the cases for people to understand, because see, most of the time what happens is either say one of the, say for example, a younger donor and father or mother, somebody has got liver cirrhosis, so they have to donate. So they're always worried about their health because they're young, say 25 to 30, and their parents are somewhere around 50, 60. So they are really worried about donating a part of liver, even though they know that it is okay to do, but then it's a major surgery and it has got its own things attached to it. So people will always worry. So in that way, the awareness is quite less. And I think as more and more liver transplants are happening, both live and cadaveric, when they are in the general public and people kind of interact with them, I think they'll realize what exactly this is, and kind of over a period of time, I think it will improve. As the requirement for liver transplant and the number of liver transplants are increasing, I think awareness of these things also would increase. It's very difficult to otherwise create awareness about live donor liver transplant. I mean, live donations also to the public. I mean, we cannot go out and talk about live donation as a part of awareness, general public awareness, I guess. If somebody comes up specifically for donation, that's always we can explain them and all those things. Right? But yeah, deceased donor, that is cadaveric organ donation, is something which even the governments are trying to do that, but then still the numbers are quite less.
Just to clarify, you're saying even if a family member wants to come forward and donate, they might be worried about the complication, but they don't have to be worried, is what you're saying, if the need
yes,
be.
Of course, if it is done in a high volume center where there is enough experience of doing those things on a regular basis, then it's quite safe.
Okay. And this person can go on to live a completely healthy, normal life?
Yes, of course, they can. I mean, we are doing transplants on a regular basis, and we have not found any specific problems as such. As long as enough precautionary measures, enough workup, and all those things are taken, which everybody would do actually. Because as health professionals, I mean, our main priority is always a living donor. Next is so living donor is always a priority for anybody who is because they are donating, being a healthy person.
All right. Before we move to the last round of questions, a word for the attendees. If any of you have any specific questions for the panelists, please type in the chat box below. We'll take that question after the last round. Dr. Somsekhar, coming back to you, are herbal supplements safe for the liver? A lot of people seem to depend on herbal supplements, but there are also experts who point out that these supplements are not safe. Where do you stand on this?
A lot of herbal supplements are available, and we have seen a lot of cases who presented to us with liver failure after taking herbal supplements. We have seen patients who came to us with bone marrow failure after herbal supplements, and even renal failure in many cases. So obviously, the herbal supplements are not safe at all. And most of the time, herbal supplements, they don't even mention the contents of the supplements in them. So they are not at all safe. Herbal supplements for any cause. Recently, there are multiple herbal supplements for weight loss and all those things. And we are seeing patients who are coming to us with acute or subacute liver failure to us after taking these herbal supplements. Maybe not everyone are prone to liver failures by these supplements, but definitely when we see 1 or 2 cases, that is enough to say that they are not safe. Definitely they are not safe. And when you asked about herbal supplements, I would like to mention one more thing here. There are a lot of medications available for jaundice. I mean, people believe in multiple things other than allopathy. I really don't understand how there are multiple causes for jaundice. Jaundice is part of liver disease. And identifying the cause and treating the cause plays a very, very important role in treating jaundice. Without identification of the cause, if someone has yellowish discoloration of eyes, everybody will be given a same medication, and they proclaim that it is a treatment. But many of them, even after those medications, they are also part of herbal medication. And we are seeing a lot of patients with multi-organ dysfunction after taking these medications. So definitely they are not safe at all.
Dr. Aditya, coming to the precautionary side of this, what are the primary liver screening tests that one should be doing before they hit the age of 30?
See, generally, if you have what I generally tell my patients is, at the age of 30 or before, if you have no other family history, then I would suggest at least getting a basic blood test, which includes your liver function test, an ultrasound of the abdomen to look at the liver, screen for diabetes, screen for all the basic things. Nowadays, there are a lot of packages available, and these basic tests are available in most of the packages. The thing is, in India, we pay for our own health, so we have every right to demand tests and get it done. And I think being aware of our own lifestyle, the way we are living our day-to-day life, the way we are eating our food, with our own family histories of diabetes being so prevalent, we should all screen ourselves for the liver, one ultrasound abdomen, liver function test, screen for diabetes or any other major cardiac issues, get an ECG, cholesterol levels, see how they are, lipid profile. These are some basic things which we can always do. Along with this, one more thing is screening for hepatitis B, hepatitis C is extremely important. Nowadays, the kids are all vaccinated against hepatitis B, but the older generation, they were not, I think we were all vaccinated later on when we were doing our medical practice. So most of the population who are in their 30s or 40s right now are not vaccinated for hepatitis B. So it is better to screen yourself for hepatitis B and hepatitis C as well, along with the basic tests. So if any abnormality is detected on any of these, then further testing I would definitely recommend, not leaving it to chance. Right?
All right. Thank you, Dr. Aditya. Dr.
Sure.
Prasanna, going to this specific aspect of old age and liver care, what are the precautions to be taken for better health in the twilight years?
I think the older age doesn't really kind of come under extra risk in terms of liver. If they have lived their life a healthy way, actually, I would say older people are much healthier compared to the younger generation, today's generation. Those who are past 60, unless they have had some other disease like say diabetes, or if they were alcoholics, or if they had any other problems. Other than that, most of them who have had a healthy lifestyle would usually have a very healthy liver, because uh, the liver, as we all know, has got an enormous regenerating capacity. Say, for example, a live donor can donate 50% of the liver, and the rest of it will grow back and will still be doing well. So similarly, actually, you don't have to take any supplement to kind of keep your liver healthy. Liver is always keeping itself kind of healthy unless you are harming it on a day-to-day basis, repeated. So that's what we are supposed to avoid with, as we have all discussed. So all those points, if taken care of, I think liver will keep itself. It doesn't really fail just like that.
Right, Dr. Prasanna. I think that's all the questions we have, and we've covered broadly all aspects of it. And we don't have questions from the attendees so far. It means that the panelists have answered all their questions already. I'd like to believe that. Before we close, I'd like closing remarks from all of you. Dr. Somsekhar, I'll start with you. And I'd also like to ask you, talked about avoiding oily food, fried food, all of these, but if we can have practical tips on how often is it okay to have, because I am sure a majority of the population will not be able to let it go off completely, realistically speaking. So any tips on that?
I would say, see, I'm asking to decrease the quantity and decrease the quantity of these types of foods and increase the quantity of fresh fruits and vegetables. Actually, completely zeroing is not possible. Definitely, maybe once in a week, that would be a cheat day. Not more than that, definitely.
All right. Any other closing remarks, Dr. Somsekhar?
Yeah. So most importantly, as my colleague panelists are also mentioning, actually, most important thing here is getting yourself checked for hepatitis B and hepatitis C. Everybody, whoever is more than 35, get your liver function test and an ultrasound, basic ultrasound done every yearly at least. So any early problems in your liver can be identified and identify the cause and then reverse them. We didn't talk about rare causes of liver diseases like autoimmune diseases and all those things. These can be picked up when we are doing a routine screening every year. So that early stages of liver diseases can be identified and if possible, reversal. All these things can be done.
All right. Dr. Aditya, before your closing
Yeah.
remarks, we have one question from one of the attendees. Navin Patru asks, what kind of dry fruits should we have for a healthier liver? Is there any specific one?
No, there's no particular dry fruit which we can recommend, but generally dry fruits are healthy. Our cashews, which are high in fat, excess. See, anything in moderation is okay. It shouldn't be excess. Badams, they are all rich in protein. They can be taken across what we say, walnuts. These are all fine. Cashews are a little high in calories, but they are, end of the day, if it is taken, I don't think we eat so many dry fruits every day that it should cause, or it should be a particular concern to cause fatty liver or as a treatment for fatty liver. So there's nothing like that. It adds to your nutrition value, definitely. Okay, so nothing in particular as such.
Okay. All right, Dr. Aditya, your closing remarks.
Yeah, so with the current the condition which we are in, I think we have covered most of the things. What I would like to suggest is, yes, we don't want to go there, but I would recommend that everybody take some health insurance, because when we look at the cost of treating liver diseases, it is extremely high. It comes to lakhs and lakhs of rupees, which the general population cannot afford. And I have seen so many patients who require transplant, who are ready to donate, but it ends up at a point where they cannot afford it, which is a very sad situation. We shouldn't reach that point where a transplant is required. The aim of this webinar is to notify or make people aware of that. But still, end of the day, health insurance matters a lot. And I think this is something which is not spoken of in our community. Everybody, we spend on everything but on health. No, so please, if you don't have any health insurance, please take a health insurance.
Very good point made, Dr. Aditya. Dr. Prasanna, your closing remarks. Also, if you could tell us the exercise duration recommended for a general population, because it is important to live an active lifestyle. But if you could give us some tips.
Yeah, I understand. But I think even if I say, tell what the recommendation is, I think most of us, including me, would not end up doing that. Rather, I would say, I mean, it's easier to do something which is easily doable rather than concentrating on exercise. Though if you're active enough to do that, I think 30 to 45 minutes of, say, kind of vigorous activity 5 days a week at least is the minimum exercise routine that everybody has to kind of keep. If not, say, if somebody is not able to do that because of the time constraints or for any other reason, I think I would rather concentrate more on eating part than kind of, if not, I mean, we should do always exercise if that's important. But at least if you are taking care of food, I think we can as well manage without that. But I would say watch out for the practical tip would be watch out for what you're buying when you're say doing a monthly shopping or something in terms of food. If you're bringing in a lot of packed food to your home and end up eating all those by the month end, I think that's what you should be conscious of. That's where most of the refined things are, most of the carbohydrates, most of the fats, everything are. So I think that's one practical tip I would always suggest everybody.
Thank you, Dr. Prasanna. I think all the panelists here have reiterated, what we tell in most webinars about the importance of a healthy lifestyle. Eat healthy, choose healthy food, and also have an active lifestyle. Move around. Make sure you get the right amount of exercise, because that is prevention, and that is what the panelists today have stressed upon. And of course, another important point that Dr. Aditya also put forward: get a health insurance. We hope you will not have to use it anytime, but just in case, that is one of the preventive measures as well. Thank you so much, Dr. Soma, Dr. Aditya, and Dr. Prasanna for joining us today and sharing your insights.
Thank you.
Thank you, attendees, for joining this session. We hope this brought some awareness on liver disease, and you will make some changes in your lifestyle, in your food diet, as well as in the exercise part of it. We hope you have a healthy liver, healthy life. Thank you so much from Happiest Health, and myself, Revati, signing off.
Thank you.
Thank you.